جديد صباح جديد مع الإنسان الخلوق الطيب دكتور نعيم صادق. يوم جديد صباح جديد مع الإنسان الخلوق الطيب دكتور نعيم صادق. الإنسان والبروف والدكتور المحترم نعيم صادق، أنت لك خبرة طويلة في مجال خدمة الأعصاب ومجال مرضى الأعصاب. قابلت كم حالة في حياتك من مرضى الأعصاب؟ كم حالة استفادت؟
والله يا أخي أكثر من 500 ألف مريض الآن الحمد لله. أوكي يعني في كثير أمراض يعني there are places where there's no computer, where you have no registry. So we have crossed 500,000 patients alhamdulillah. And we have patients from alhamdulillah all over the world. يعني Khalij, the entire Khalij, Saudi Arabia, Emirat, Oman, Kuwait, Bahrain. Then we have, if you come down this side, you have Canada, US, China, Russia, Germany, France, Poland, Australia. Alhamdulillah, we have patients from all over the world, and I would give an approximate, alhamdulillah, between 70 to 80% of patients recover. Now, patients who do not recover are the ones who come in the end stage, where the chances are very little. Bifadlillah, we have received more than close to 75 to 80 national and international awards from all over the world.
من هو نعيم صادق؟ وما هو تاريخك في الطب مع الخلايا الجذعية؟
دكتور نعيم صادق, that's me. الحمدلله بفضل الله أنا أشتغل من 1988 يعني تقريبا 37 سنة الآن. I have specialized in the field of neurosciences يعني أمراض بالنسبة لمخ والأعصاب خصوصا. أنا أشتغل من ممالك and جيت هند قبل 14 سنة 2011. then I started مركز بليكسس. بليكسس هذا مركز مو مركز صحة بس. This is a center which gives new life. This is a center which gives hope for the people who have lost hope. And all kinds of neurological illnesses, especially the ones which are degenerating. يعني كل يوم في خشونة أكثر من يوم أول. يعني it just progressing. يعني مثلا مرض شلل رعشة باركنسون. يعني بداية بس في شوية رعشة لكن you will see after some time it goes on and the person is totally bent, cannot even get up, cannot do his...
worsening with the time.
It progresses. He cannot brush his teeth, he cannot do any of his things. Or like for example, we have conditions in children like cerebral palsy. يعني ضمور في المخ or توحد, autism spectrum disorder. Now these are conditions for which there is no cure. And people have been looking all over, trying all kinds of treatments. Then I said, okay, why not do something where inshallah shifa biyadallah. Allah is the one who gives the result. But let us try something and do something by which we can give new life to these children, new life to these people. Based on that, I've been practicing for the last 37 years. And now, for the last 14 years, we have started working on the field of stem cells, الجذعية. So I'm sure you'll want to know what is this, how does it work. I'll give you a simple example. Now we shave every day and next day we have a beard again. The hair is growing. We cut our hair, the hair comes. Every week we clip our nails, again the nail grows. Suppose we fall down somewhere, the entire skin is gone. But after 2 weeks, we see the new skin come up. Now, how does this happen? The body regenerates. Whatever damages are happening, the body has the capacity to reproduce these cells and make things all right in a normal individual. لكن إذا كان في مرض, if some organ is diseased, this process stops. ما في تجديد. يعني خلايا في موت ما في خلايا جديد. So in our body we have something called as the mother cell يعني أم الخلايا. Now from this we get خلايا المخ, خلايا العصب, خلايا المفاصل, جلد, شعر, عيون, قلب, كبد, كلى, طحال. All these are the cells are produced by this خلايا الأم. Now where is this present? This is present in the bone marrow, that is نقاع العظم. This is present in the fat, شحم. This is present in our blood. So what do? We do a small procedure. ما في عملية. بس with the injection we take a little of the bone marrow.
قبل ما نأتي إلى تفاصيل الخلايا الجذعية نحب نعرف متى كانت بدايتك؟ متى بدأ مركز بليكسس؟ And when did you start?
Yeah, very good question. So basically, you see, neurosciences is a field where you have diseases for which there is no hope. Now, if you ask me, why did I do this? It goes back to the history of my own father. Okay, my father was suffering from a neurodegenerative disease for which there was no cure. And I tried every part of the world, everywhere, tried everything, including Ashab and everything. Nothing worked. So then we started doing research and looking into it, and this field was very interesting because here you could see things happening, and this Khalat al-Jazia is a very old science. Now people started doing this in US, in Russia, in China. I said, why not start working on it? And medicines are not giving any relief. There is no surgery. You see a person degenerating, going down every day. But this field is giving some hope, and based on that, I started using this technology in my own field. I'm using الخلايا الجذعية for all neurodegenerative diseases, for all neurodevelopmental disorders, plus certain other disorders for which there is no cure.
Sir,
Trying to give a hope.
Yes, sir. Now we have come to know that since 14 years you have been dealing with stem cells. You have been treating different cases from different parts of the world who are suffering from neurological disorder. What is Plexus as a family? What Plexus is providing for the patient, and what can we find when we come and expect to find in Plexus when we arrive to Plexus?
See, at Plexus you have a combination of everything. This is one center where we treat all these disorders using what we call as regenerative rehabilitation, where we regenerate the tissue. Like for example, now take a case of spinal cord injury, where the spinal cord is cut and the signals are not passing, person cannot move. So we inject the stem cells. After injecting the cells, we do the rehabilitation, tahil tibbi, along with certain medication, lifestyle modification, everything is done in one center, both injection and rehabilitation. It's a complete holistic package which we give the patient.
Sir, how is the procedure of stem cells? Harvesting the stem cells and giving the stem cells back to the patient. How this works and how long the duration for this process?
Yeah, we take the bone marrow with a simple syringe. It is not a surgery. We just put the needle in the hip bone, take out the bone marrow. It takes about 2 minutes. It is as simple as drawing the blood. And once we take this, we do the processing. Now, depending on the condition of the patient suffering from and the stage of the disease, we decide how many cells to be given, what is the thing, and then the process starts. And the first injection generally we give the same day, and then the second and the third and fourth injection we plan a schedule and start giving depending on the disease.
Sir, for international patients, surely that you have worked with so different international patients. Now, most of the people, أكثر المرضى اللي يجونا من الدول العربية يحبوا يعرفوا ما هي الخلايا الجذعية، كيف تساعد الخلايا الجذعية الحالات، ما هي أكثر الحالات اللي ممكن تستفاد الخلايا الجذعية. عندنا في المنطقة العربية نشتكي من أشياء كثيرة، بالذات عندنا أطفال التوحد، مرض مشهور جدا أو معروف في المنطقة الخليجية في المنطقة العربية. عندنا الصدمات النفسية، المشاكل النفسية اللي تحصل للناس، زي ما أنت أخبرتنا، صدمات السلسلة الفقرية، قطع السلسلة الفقرية أو قصف السلسلة الفقرية. بالنسبة لهذه الحالات وحالات التوحد، كيف الخلايا الجذعية بتقدر تغير الحالة؟ كيف تقدر تأهل هي انت قلت انها تعتمد من حاله لحاله، لكن ما هو يتوقع المريض لما يجي.
Now مثلا spinal cord injury. اوكي، نفرات في الخليج اكثر شيء يعني في السعوديه حادثات سياره road traffic accident, and now we have so many cases coming from Yemen and Sudan, and after the war gunshot injuries,
Yes.
you know, where the spinal cord is severed. So what happens here when we inject the cells, you know, we find out where exactly is the injury, and depending on where the injury is, we inject the cells. So the damage which has happened starts getting repaired. And then you see what was not happening over a period of 1 year or 2 years or 3 years starts happening in months. So patients who come and alhamdulillah within يعني شهر شهر ونص شهرين هو يشوف تحسن 20 30 40% الحمدلله. Okay. Now when you're asking tawahud is a very very good condition. يعني في كثير أطفال من الخليج who are suffering from tawahud يعني هو استعمل علاجات they are doing therapy لكن في 5-10-20% تحسن and then it keeps fluctuating. يعني ما في تحسن which keeps progressing. So what do خلايا الجذعية do here is they maintain the stability of the brain cells. And the new cells which are introduced, they reduce the inflammation of the cells which are there in the brain. So after you inject the cells, when you do therapy, you start seeing results like this. Something which didn't happen in 6 months will happen in 6 weeks. So the result happens very fast. Or take ضمور في المخ سبب نقص oxygen, شلل الأطفال. So common it is. Now here the brain is damaged. يعني خلايا المخ ما اشتغل نهائي أبدا موت. So now these new cells will go and start doing the function of the cells which are not working, and they stabilize the entire cellular structure in the brain.
So how can you see the changes of a patient in his activity with autism before treatment and after treatment?
You see the difference. The child who would not sit and jumping all around, you know, keep moving and restless, looking here, looking there, closing the ears. In 2 months, 3 months time, inshallah, he's sitting quietly, listening. Call him, he answers. Now, before you call his name, he's not looking at all. You talk to him, he's looking somewhere. But after the treatment, in about 2 months, 3 months, 4 months time, depending on the stage of the thing, he starts looking at you, responding. You tell him, Ya Abdullah, ta'al hina, he comes. Ya Abdullah, jeeb hada, he brings. Ya Abdullah, ijlis, he sits down. And all those activities which he was doing, they all start coming down.
التعلم مشكلة كبيرة جدا لهذه الشريحة من الأطفال. Education and getting involved in the schools. How this might change?
All this will change. So once all these activities come down, see, first you have to sit.
Correct.
Okay, now you're asking me a question. I'm sitting, listening to you, processing it and answering it. Now if I'm running all over, moving like this, doing this, you have asked me something which has not even entered my mukh. So this process starts from the first week itself. After we inject, you start seeing changes happen. See, it is not like this. It is not like a switch. It is not like a miracle. No. The process happens faster, number one. And number two, because of all these hyperactivity and the sensory issue coming under control, the child starts responding. His cognition improves. His intelligence improves. He knows how to hold a pencil. He knows how to write. He knows how to draw. He knows how to calculate. All these things start falling in place, inshallah.
Inshallah. So you have spoken about your own father and how your own father has suffered from a disease which a neuro disease have. This is a very important family. أبائنا، أجدادنا، أعمامنا، الناس اللي تعاني من مشاكل. أكثر الأمراض عندنا في المنطقة العربية إنه الأشخاص في عمر 60 70 يشتكوا من مشاكل خشونة العضلات، خشونة المفاصل، مشاكل في الظهر، مشاكل، والناس ما تبغى دائما إنه العملية الجراحية. أحيانا في أشخاص في أعمار كبيرة 60 70 سنة يشتكوا من مشاكل سكر، يشتكوا من مشاكل ضغط. تكون صعوبة لهم أن يدخل العملية جراحية مفتوحة أو عملية كاملة أو حتى إلى الرجوع في العناية. كيف الخلايا الجذعية تقدر تغير في حياة هذه الحالات؟ كيف تقدر تساعدهم؟
كثير الحمد لله. اوكي، مثلا خشونة في الركب. يعني نفرات بعد مو 60 بعد 40 45 في خشونة، يعني درجة أولى ثاني ثالث ورابع بعدين على العربية. صح عملية موجود يعني total knee replacement 1 2 or 3 نتيجة مرة حلوة إن شاء الله. لكن فوق stage 3 و 4 صعب جدا. So إذا كان if the patient has pain he cannot perform salah, you know, he has to sit on the chair and pray. Alhamdulillah, after the injection, if he is in the early stages, he will be able to perform his daily activities, climb upstairs, come down. Without surgery, we can do that. Okay. Now talking about the old age, what you were saying, where there is one is knee, second yes sugar, and third very important thing is what happens at this age is jalta fi damagh.
Yes, common thing is stroke.
Or you have dementia, Alzheimer's. Even this, if it is detected early, results are very good. A person who is not able to understand, not able to remember, not able to recognize, if detected early and if we do the treatment with Khalaya, Alhamdulillah, the results start coming up. He starts becoming better so that he can lead his daily life in a much comfortable way. And Alhamdulillah, it's all by the grace of Allah, and we are able to serve many more people from all over the world, people who are suffering, giving a new life.
تابعونا إن شاء الله على قناتنا، حيكون لنا حلقات أخرى. تقدروا تعرضوا لنا أسئلتكم وتساؤلاتكم في التعليقات. مشكور دكتور نعيم صادق.